Okay, guys, hello. This is Steve Lynch. I'm a licensed massage therapist for the Limestone Therapeutic Massage in Newark, Delaware. Um, my background is clinical, medical, orthopedic, as opposed to, say, spa or relaxational massage. And I just wanted to bring a little quick clarity in today because um, you know, we're getting to the point in the massage therapy practice that we are understanding the value of medical or clinical massage work. In other words, we feel that it is every valid of science as, say, chiropractics or orthopedic, general medicine, and it has proven itself out over the centuries. And so, to understand medical or clinical orthopedic massage, I think it's fair for us to ask the question first. Well, what is it, or what it is not? Medical massage, orthopedic massage, clinical type body work is not relaxational. It's not a spa type modality where you're going to go in and you're going to relax and someone's going to slather lotion all over you and okay, yes, there may be music, you may be in the prone position, you may not be, depending upon what the challenge is with your body and what the treatment calls for. But it's not one of those fluffy kind of things that you go in and you pay money for at a spa and basically just relax for an hour or an hour and a half. Clinical or medical orthopedic massage is treatment protocol that is centuries old. Say back to the time of Hippocrates, Dr. Galen, and certainly in the Chinese medical manuals as old as, say, 5,000 years ago. It was designed to aid in recovery for specific ailments, pertaining to the musculoskeletal system, and that means muscles, tendon, ligament, fascia, and people don't really get that this is a whole medical field that really, aside from the clinical massage therapist, it's not really dealt with. Your chiropractor is going to be dealing with the axial and appendicular skeletal system in a manner that's going to require what we call manual thrusts or ballistic rotations of these systems to affect the skeletal system, the orthopedic system, the articulative surfaces of the bones. For the most part, chiropractors are not really concerned with soft tissue, tendons, ligaments, fascia, muscular structure. They understand that there's imbalance there, but for the most part, their dogma, their philosophy is, hey, if I open up the vertebrae to allow for more nerve function to flow through the nerve roots coming out of the vertebral bodies and into the nerve plexi, then of course that's going to solve all the problems. Well, I think it's a valid science, and I think that it's been proven successful. I think they're long overdue in the recognition they get from the medical association. That being said, they don't pay very much attention to the soft tissue concerns. And now they've come to see massage therapy as sort of an add-on or adjunct. They recognize the value of having soft tissue clinicians, somatic clinicians on board but they don't really recognize it as a valid science. So much the same as the chiropractors were to the medical association years ago, so are the um, clinical medical therapists, somatic clinicians of today. And so what we have here is a treatment protocol. Let's just take temporomandibular joint disorder, for instance. TMJ for short. Most of you know what TMJ is. We've all had some kind of bouts with TMJ types symptoms, signs and symptoms. And, the chiropractor is going to get in there and he's going to try to find some way to deal with that particular joint structure in a rearticulation kind of protocol. But for the most part, they're not going to really identify the challenge for what it is. And for the most part, temporomandibular joint disorder is a wearing down of the articulative surface of the disc at the temporomandibular joint due to hypertonicity, hypercontraction, adhesion, inequality, or non-bilateralism of the jaw muscles, the mastication muscles themselves. And so a good neuromuscular therapist or orthopedic clinician will get in there and they will deal with all the connective tissue and the muscle bellies, and particular scar tissue and things of that nature associated with that particular disorder. And then, okay, once the soft tissue concerns have been dealt with, then there is a positive result which can facilitate a chiropractic rearticulation that will actually hold, and or the addition of your dental concerns, such as occlusion tests and re-grinding of certain areas, which are going to make sure that everything now is indeed bilateral and it's going to stay that way. But you have to address all the concerns, and so that's kind of what I'm alluding to in this video when we're talking about the difference between all your fluffy spa modalities, your soft glows, your clay wraps, your mud wraps, your dry brushings, all these fluffy little treatments, and of course Swedish. The medical association and the chiropractic boards and everything, they kind of want to allude to Swedish as being this glossed over generalization of technique protocol used by all massage therapists, when in fact, indeed, it's far from the truth. You've got your orthopedic people and clinical people like myself, who spend long hours studying musculoskeletal pathologies, maladies, and surgical procedures, and all nature of things musculoskeletal related, to better understand, even down to the direction of the particular muscle fiber and line of pull associated with that muscle fiber in relation to the joint structure or to the medical pathology that we're dealing with. So it's quite different from the glossed over generalized Swedish massage, which is so much alluded to by people when they're talking or writing about massage therapy and its efficiency or effectiveness. We're looking at several studies today, and of course we want to be very careful in a litigious sense, not to diagnose or say that we heal or we can diagnose anything, because, well, that's what Big Brother says. You can't do it. Because why? Because evidently we're not smart enough to figure out anatomy and physiology and pathophysiology and kinesiology, all the things we really do study. So in a litigious way, we're daft, dumb, and blind. And so that is the way that we are presented in articles. They may say, well, massage therapy in general, Swedish massage is good for headaches. It can treat emotional or nervous conditions. It's good for circulation. Blah 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 blah. And they will stay as far away from actually admitting that good somatic clinicians deal with orthopedic concerns and rehabilitative post-surgical concerns, as well as pre-adjustment chiropractic concerns, soft tissue concerns. And this particular field is as old as time. It's been properly utilized throughout the centuries, and sad to say that the other medical practices are doing their best to bury the usefulness of good hands and good understanding of the musculoskeletal system. So, having said all that I've said, there is a vast difference between general Swedish massage and general spa type modalities and orthopedic concerns. Good orthopedic clinicians, clinical massage therapists, medical massage therapists could be and are in a lot of instances some of the most useful people on a PT floor or rehab clinic, just because of the effect that good massage therapy techniques, good orthopedic techniques such as stripping useless collagen fibers off of tendons, separating fascia from muscle, breaking up scar tissue, separating adhesions, and in general bringing back bilateralism to the muscular structure are concerned. These are techniques that your average massage therapist they may hear about, or they may read about, but it really takes a dedicated practitioner to continue to study and continue to practice their techniques and understand exactly what they're doing to certain areas of the body, and what its effectiveness is for certain pathologies. So why medical massage? I've just given you about 12 and a half, 13 minutes of why and what. And if you have any questions, I'm going to put this certainly up on YouTube. My email is aguadude@yahoo.com. You can find me on my website at stevelynchlmt.com, or you can contact Limestone Therapeutic Massage in Newark, Delaware, or you can go to their website, limestonetherapeuticmassage.biz.com, and present questions or make an appointment. And anyway, this is Steve Lynch, LMT, signing out. And if you have some challenges, do a smart thing. Go see an orthopedic or a medical massage therapist. The chance is that they're going to find a solution for you that's going to aid in your recovery, it's going to improve your athletic performance, your general pain-free range of motion, and or prevent surgery altogether. In closing, I don't want to give the impression that I'm poo-pooing the Medical Association or the Chiropractic Association, because I do feel that all of these things work together. There's not one particular modality that's the end-all be-all. So if you apply all these things in the proper context, you can be a healthy, well, pain-free kind of person with great performance. Okay, see you later.